Next point is hook of the hamate. Hamate is a carpal bone, it is a short bone, hypogenar eminence. Here, this is the marking for pisiform bone. So, I will go below this, about 2.5 centimeter below this pisiform bone on the hypogenar eminence and along the line of the medial border of the ring finger. So, here is the point for hook of the hamate. The attachment on the hook of the hamate, flexor retinaculum, pisohamate ligament. The hamate is a bone of the distal row of the carpal bones. You know there are two rows, proximal row and distal row. In the distal row there are four carpal bones. From lateral to medial, this is trapezium, trapezoid, capitate, then this is hamate. So hamate is the medial most distal row carpal bones. Among the proximal row, there are scaphoid, lunate, tricotal and pisiform. So there are 8 carpal bones. Hamate is one of them. Next to the capitate bone, it ossifies after birth. Next point is the point of bifurcation of brachial artery. You know brachial artery is in the arm. Then just below the bend of the elbow, this is the bend of the elbow. It bifurcates into two main branches: radial artery on the lateral side and ulnar artery on the medial side. About 1 centimeter below the bend of the elbow, here I will mark a point for the site of bifurcation of brachial artery. And if you feel in the cubital fossa, there are 3 important structures are there. From lateral to medial, this is the biceps tendon, and medial to it is the brachial artery. Then I will get the median nerve. So this brachial artery here divides into radial and ulnar artery from its bifurcation. Next, tip of the coracoid process. This is the coracoid process of scapula. So I will mark the tip. To mark it, I will palpate the clavicle. This is clavicle here. So I will divide the clavicle into medial 3/4 and lateral 1/4. So here this is the midline. So medial 3/4 and lateral 1/4 here. 2.5 centimeter below this junction. Junction means medial 3/4 and lateral 1/4. Here is the junction, and 2.5 centimeter below this junction is the position of tip of the coracoid process of scapula. What type of epiphysis is this? This is an example of ataphistic epiphysis. And other example of ataphistic epiphysis is posterior tubercle of talus, which is a bone of the among the tarsal bones of the lower limb. And this tip of the coracoid process, it is overlapped or covered by the deltoid muscle. This is deltoid, and the muscles attached to the tip of the coracoid process are 2. You must remember the attachment of these 2 muscles. The one is the short head of biceps from the lateral side, and medially it is the coracobrachialis. And few important ligaments also attached at the coracoid process. That ligaments are coracoclavicular ligament, then coracoacromial ligament, and suprascapular ligament. Suprascapular ligament, it is attached at the medial margin of the root. Next point is acromial angle of scapula. This is scapula, this is acromial process. This is spine of the scapula. So I will follow the lower border of the spine, then I will go laterally. Here I will give a bend. That bend is the acromial angle. Now I will mark this in the scapula here. So here posteriorly I can feel the spine of the scapula. This is the spine. I will go laterally. Here I will get a bend. That bend here is the acromial angle. So I will mark a point on the back at the side of acromial angle. The questions from the acromial angle: how many borders and surfaces are there of the acromial process? It is having superior surface and inferior surface, and 2 borders, lateral border and medial border, and this one is the acromial angle. And the muscle attached on the lateral border here is the deltoid, this is the origin, and medial border is the middle fiber of trapezius, this is the insertion. And the acromial process, it articulates with the clavicle, this is the acromioclavicular joint. And beside this, one important ligament extends from the coracoid process to the acromial process in this way. This is called coracoacromial ligament. Under surface of the acromial process coracoacromial ligament and the coracoid process form a coracoacromial arch which forms the secondary socket for the shoulder joint. This is shoulder joint and it is the arch. It forms a secondary socket for the shoulder joint. Next part I will show the beginning of brachial artery, radial nerve, median nerve and ulnar nerve. I already have shown you the termination of brachial artery. Now I will show you the beginning of brachial artery and the three important nerves. For this, the person is asked to abduct his shoulder and then laterally rotate so that the palm it is facing upwards. Then I can follow the anterior axillary fold. This is anterior axillary fold and this is posterior axillary fold. I will come to the lower end of the anterior axillary fold. I will put a point here. Here also I will put a point at the lower end of the posterior axillary fold. Then I will join these 2 points. And this is the anterior 2/3 and posterior 1/3 of this line. So anterior 2/3 means up to this, then posterior 1/3 means up to this. So I will mark a point here at the junction of the anterior 2/3 and posterior 1/3 of this line. So this is the point of origin of brachial artery, radial nerve, ulnar nerve and median nerve. Let us discuss few questions on these structures. First of all, brachial artery. Brachial artery, it is a continuation of the axillary artery at which point the brachial artery is formed. Below the teres major muscle, the axillary artery becomes brachial artery. And next nerve I told you that is the radial nerve. Radial nerve is a branch from the posterior cord of brachial plexus. Its root value is the dorsal branches of ventral rami of C5 to T1 spinal nerves. It is having 5 branches from the posterior cord. Among the 5 branches, radial nerve is the largest branch and one of the important branch of the posterior cord, and it supplies the extensor compartment of the arm and also the forearm. And injury of this nerve condition called wrist drop. And next is median nerve. Median nerve, it is a nerve which is formed by the 2 roots, medial root and lateral root. The 2 roots of median nerve, median root from the medial cord and lateral root from the lateral cord. These 2 roots join to form the median nerve at this level. And this nerve also having the root value of C5 to T1. And there is no branch of median nerve in the arm, but it enters into the forearm between the superficial and deep head of the pointer teres muscle here. Then another important nerve of the upper limb is the ulnar nerve. Ulnar nerve, it is a continuation of the medial cord of brachial plexus. Its root value is mainly C8 and T1 and maybe C7. And the ulnar nerve, it supplies most of the muscles of the hand, and in the forearm it supplies the flexor carpi ulnaris and the medial half of the flexor digitorum profundus. And it supplies the medial 1.5 digits, but median nerve it supplies 3.5 digits. And median nerve it supplies most of the muscles of the forearm, so it is called the leverer's nerve. But the ulnar nerve it supplies most of the muscles of the hand, so it is called the musician nerve. So that's all.